Senator Hillary Clinton is in Washington this morning. Senator, good morning to you.
Good morning, Matt.
You talk a lot about the scars you have from 1993 and your efforts to reform health care back then, but this plan's only been out there for 24 hours, and already critics are saying that this in some ways is the kind of plan that you would have rejected back in 1993. How do you respond to that?
Well, I think it's absolutely the case that I've learned a lot in the last 15 years. I think America has. I think we all understand that ignoring the problems don't make them better. We have more uninsured people, millions more that are underinsured. We're losing jobs because of the global competitive pressures on American business. And so I think it's important that you take a new assessment, and that's what I've done. I've worked hard to, listen to a lot of people, learn from what we tried to do and were not successful in doing before.
But in avoiding those battles this time around, Senator, have you watered down reform?
No, I think what we've done is to come up with a practical approach that will actually move us and achieve universal coverage, but without disruption. If you like your health insurance, you like your doctor, you like your hospital, nothing will change. But if you're among the 47 million uninsured or millions who think they should get a better deal for what they're paying, you will now have the same choices that members of Congress have. And I think that's a significant move based on what we think will work better.
Let me read you something. Jamie Court, who's the president for the Foundation for Taxpayer and Consumer Rights, told Newsweek magazine. He said, quote, "There's nobody in this race with her knowledge to make health care available to every American at a cheaper cost. But it would take going after the insurance industry that's funding her candidacy. In fact, some of your competitors have said you've taken more money from the insurance industry than any other candidate." So the question is there a conflict looming on the horizon? Are you losing some leverage in asking these insurance companies to get on board and make tough choices?
Well, I don't think so, because I believe in reality-based politics. And the fact is that my plan is very tough on requiring insurance companies to guarantee insurance to everyone, no exclusions for pre-existing conditions. They're going to have to change the way they do business, and I believe that they can and they will. We'll either work with them or we will make the case based on all of the rest of us that we cannot continue on the path we're on. So I think that this system, which builds on what works in America but fixes what's wrong, is exactly what is prescribed, and I'm thrilled to have the positive responses I've been receiving from so many groups, physicians, nurses, hospitals, the people who actually deliver the care. The insurance industry is not going to nominate me for Woman of the Year because I've always been tough on what I think are practices that undermine the quality and cost of health care. But I think that they will recognize that the time has come. We cannot continue on the path we're on. We are undermining our health care system and, frankly, undermining our health.
A couple other questions that your campaign's been dealing with lately. Let me talk about Norman Hsu. He's in jail right now on apparently had a 15-year outstanding warrant. Your campaign returned an $850,000 contribution from him. Just so people understand, he's a bundler. That's not his money. This comes from 260 individual donors. The question is, there are a lot of red flags here. What happened? The New York Times writes this hurried but not hurried enough give back, one of the largest on record, lays bare again how easily campaign professionals can allow greed to trump healthy skepticism and good sense when supporters like Mr. Hsu arrive on the scene with eye-popping contributions. How do you respond?
Well, obviously everyone was taken aback, to say the least. Not only the dozens of candidates who were the beneficiaries of contributions, but the people who actually gave him money for investments. And it was a terrible and rude awakening. The fact is we need to move toward public financing. I've been saying that for years. I will strongly support that as president. And my campaign has a good system for checking. This was missed. It was missed by everyone who looked.
So when your campaign returned the money, they said you're operating under an abundance of caution. Are you saying there wasn't that same abundance of caution when the check arrived?
Well, yes, of course. We always check everything and check every person, but it wasn't just my campaign. Unfortunately, this goes back several years, and the databases that were used didn't have this information. As soon as people found out, we all took action.
Senator Hillary Clinton joining us from Washington this morning. Senator, thanks for your time. I appreciate it.
Good to talk to you, Matt.